Hey, what is up, Z-Pack? It's Z-Dog-MD, Dr. Zubin. Okay, I brought Homeboy back, and I don't often do that with guests. There's just a handful of guests we brought back because they're so awesome that they need to come back. And my boy, Dr. Ronesh Sinha, he goes by Ronnie James Dio, if you're nasty, is a internal medicine physician, director of corporate wellness at the Palo Alto Medical Foundation, which is my former organization. I had him on the show about 2 years ago talking about South Asians in particular and their particular brand of metabolic illness, diabetes, polycystic ovary syndrome, etc. And that was such a great show. And then I moved back to the Bay Area and I'm like, we're neighbors, come by beyond the show. And then I heard him recently on Peter Attia's podcast, who was on our show as well, talking about all the things. And I said, we need to go deeper into the quote unquote touchy-feely stuff that Peter didn't have time to dig into. So everybody, welcome back to the show, Dr. Ron Sinha. What up, Ronnie James?
Hey, what's going on? I hope the sequel is as good as the original. Let's see
Dude,
how
the
it goes.
sequels are always better. We know this.
Right.
I mean, look at Superman 2. Do you remember that one?
We are doomed. Yeah.
You will kneel before Zod.
Oh, great. Nice.
Actually, the most poignant moment in that movie was when Superman's he's back to being Clark Kent. His powers have been given up, relinquished, and he's just humiliated in that little bar in Alaska. He gets punched and beaten up, and he's bloody. Lois Lane has to drag him out of there. I'm like, this is true human vulnerability. And finally,
Right.
Superman feels like us.
Yes, that was empowering. Yeah.
Exactly. So,
Nice.
What I want to talk about today, because there's so much stuff, right? And I actually put it out to the fans. I'm like, what do you want me and Ron to talk about? Because you've done something remarkable. Internal medicine, you could have been a cog in a machine of corporate medicine. And instead, and we worked in the same place.
Yeah.
It's very easy to just go in, punch the clock, do your job, click the boxes, complain, go home, take it out on your kids, go to bed, repeat.
Yeah.
It's very hard now. And there's so many expectations. But what you did is you saw something in your patient population because it resonated with you because you're Indian, you're Bengali. And you saw this pattern of disease and a pattern of suffering, more specifically. Yeah. That instead of saying, oh, yeah, this just seems to happen in Indians, South Asians, we just deal with it. We do the same medicine we do for everyone else.
Right.
You actually took it on yourself to explore it to a degree where you are now a national and international expert on metabolic disease, on stress, on how to manage this in this population. And how did you even get down this route?
Yeah, it's a great question. I mean, I was seeing this disorder so rampant in my patient population over a decade ago. And I think what really hit was, number one, I had no practical ways to help anyone because there were no good resources out there to really intervene and say, like, if you've got an Indian vegetarian with metabolic syndrome, do you give them a handout on the with a Mediterranean food pyramid, or what do you give them? A low-fat diet, American diet? There's just so many limited options out there. So I decided at that point that we need to start creating some resources to really engage these individuals. So the first step is really finding something that resonates, but also finding a gap. And there was a huge gap. You can find resources maybe for other cultures, but there was nothing really for South Asians at that time.
But why? What's going on with South Asians? Like, what were you seeing?
I mean, basically what I was seeing is, in med school, if you remember us doing case studies, right? When you'd see a heart attack case study, it wasn't typically a 30-year-old engineer that works in a sedentary profession. It was kind of unheard of. So I was seeing a phenotype that was so different than what we learned about in medical school that it was shocking to me. Just seeing people coming in that early with chronic illnesses that I thought would present decades later. So that kind of hit a light bulb already. Then I dug into the research at that time, and I really had trouble finding really good resources that helped highlight that problem. So if I saw a one-off, in the beginning it was like, okay, maybe this is an exception. But this was becoming a rule. I mean, I was seeing people coming to my clinic one after the other, and every single individual that walked in had some sign of insulin resistance, high triglycerides, prediabetes, some sort of manifestation there. So it was literally an epidemic that I was seeing in my office.
And this was not publicly discussed. So this is the thing where I remember training at Stanford in the late 90s, early 2000s, and you'd be on the CCU, and there would be a huge number of young Indian men.
Yeah.
And then I practiced at Palo Alto Clinic with you, and I
Sure.
would rotate through Fremont, Washington Hospital, young Indian men
Absolutely.
with LAD disease, multivessel disease,
Yeah.
going for cabbage. And they're like 30 and 40. They're engineers in these top Silicon Valley organizations.
Yeah.
And I'm like, something's going on. And,
Exactly.
it's funny, all the Caucasian ER docs,
Yeah.
they'd be like, oh, we got another Indian guy. Better just like basically admit him. I mean, they
Right.
recognize the pattern.
Yeah,
They didn't realize what it was. Now, you said the term insulin resistance. Can you explain for people in the audience that don't understand what that means? Because even people like Peter Attia,
Yeah.
it can get really deep into a rabbit hole. But how
Yeah.
do you think or explain to your patients about insulin resistance?
Yeah, at the highest level, what I would say is, insulin is basically a hormone in the body that helps triage different nutrients into different sites. So specifically, if we're consuming carbohydrates, insulin will help triage that glucose from the carbohydrates to different tissue sites. If we focus at one, the way I sort of use this in lectures in my book is think of sort of glucose, for example, as being a car in the body. And we've got 3 parking lots, okay? 3 major parking lots: muscle, liver, and fat. And in an ideal situation, when you have glucose in the bloodstream, that glucose car that's zooming around, you want to push that glucose car into the muscle parking lot so the muscle can burn that for energy. The way the car gets inside that lot is by using a parking pass called insulin. Insulin will open up the door so glucose can get inside. Now, when we say somebody's become insulin resistant, what happens is basically your body is producing the parking pass, but that muscle parking lot is not responding to the pass. You're putting the pass into the gate, and the muscle is basically not opening up the gate. So then you've got this spillover glucose that now has to go into different sites. So number one, it might go towards your fat cells, and your fat cells can convert that glucose into fat, adipose tissue, and we develop obesity as a result of that. It can go to your liver, and your liver can take that glucose and also turn it into fat in a form called triglycerides. And then the body tries to compensate for this problem by producing even more insulin. So individuals that have insulin resistance, we have this condition called compensatory hyperinsulinemia. They've got very high insulin levels. And on a daily basis, if you have high insulin levels, you're just more prone to obesity. You think of carbs, you're going to gain weight. So it's basically the initial insulin resistance that's the problem, but then it's that compensatory elevation of that parking pass that causes even more issues. And aside from insulin causing obesity, insulin also causes vascular dysfunction, so it can cause inflammation at the blood vessel level. It can lead to associated conditions like PCOS and gout and everything else, and that's really coming from excessive amounts of insulin. As you know, if we didn't have insulin, we'd die, but just like so many things, it's all about moderation. We want insulin to be at the right level.
So
yeah.
this is a very important distinction. And again, insulin resistance is bandied around a lot.
Yeah.
And you can go deep into the rabbit hole of what causes it. Is there a chicken and egg thing?
Exactly.
What's the ultimate meaning of it? People like Dr. Jason Fung have postulated that this parking lot of muscle doesn't let glucose in, not because there isn't enough insulin or that the insulin isn't opening the gate, but that the parking lot is full.
Right.
And so that's one theory. There's other theories, but the bottom line is you end up with this, vicious cycle of rising insulin levels,
Yeah.
and insulin itself being harmful in the sense, like you said, effects on the vasculature. It's anabolic. It's a growth hormone.
Exactly.
Whether there's questions about tumor genesis and cancer. And what you were seeing in the South Asian population, the East Asian population too, yeah. And what you were seeing is kind of like a test case, almost like this is the guinea pig group that has the genetics that tends to be insulin resistance if you treat it wrong. Whereas in India in the old days, people are walking everywhere. They're squatting.
Yeah.
They're eating a high carbohydrate diet, but they're exercising a lot. And it's not a lot of processed food and other stuff. And so they
Yeah.
were able to do fine.
Yeah.
Now you take those same people and you put them in the Western diet and everything goes haywire, presumably due to insulin resistance as the primary cause. Is that correct? Or am
I would
missing
say so,
anything?
absolutely. And you're absolutely right. The parking lot analogy was a way for me to sort of simplify the understanding so common people can learn that. But you're so right. I actually don't think the parking lot is the exclusive cause of insulin resistance. There's multiple theories. There's free fatty acid toxicity at the receptor level. There's so many ways we can go. But in my job where I just want to get people healthier, I don't want to add confusion to the conversation. I need the lowest hanging fruit that's going to help sort of solve this problem. And then we can dig deeper if we find certain nuances to that. So I think just like, in the days of the low fat diet, unfortunately that didn't go very well, but we had a simplistic model of fat raises dietary cholesterol, aka causing plaque, and this leads to heart disease. Hopefully we're not being a little bit careless about oversimplifying the model, but I think some simplification helps people understand that this is why unhealthy vegetarian, i.e. somebody from India who's eating a lot of carbs, can develop rampant diabetes and heart disease without ever touching saturated fat. Yeah.
And this is a key point. A lot of these folks are vegetarians, and you would think, that should protect them against heart disease, diabetes, etc., especially if you believe the vegans. But the difference here is that we have a lot of carbohydrates in an insulin-resistant tendency population, and you said something very important early on. The liver is one of the parking lots for glucose. It's fat, liver, muscles, the big ones, right?
Sure.
The liver actually turns excess glucose or fructose, depending on what you're eating, into triglycerides, which are a kind of fat.
Right.
And they're circulating in the blood. So people with this metabolic syndrome can have elevated triglycerides that aren't due to fat consumption. They're due to carbohydrate consumption.
That's exactly correct. Yep.
And did I ever get taught that properly in school? I don't remember being taught that properly.
Right.
I'm sure it was spelled out as a metabolic pathway, but all we heard was fat begets fat.
Exactly.
And high triglycerides, you better lower the fat in the diet. And
absolutely. And even when you go, we see so many individuals with fatty liver. And if you Google fatty liver and go to all the most established healthcare institutions, if you look at their handout, rarely any of them mention anything about lowering carbohydrates or sugar. It's still focused on low fat. I think some entities are changing, but it's always like the bottom bullet point on that list. And so it leaves individuals confused and on the wrong path.
Right.
Yeah.
So now you have this population of patients that you take care of specifically, but you do other things as well, which we'll talk about. But let's stick with the South Asian population, because I think it's a good case study for what's going on with diet, genetics, stress. One of the manifestations of insulin resistance is frank diabetes, heart disease, cancer potentially. In fact, you're seeing breast cancer is younger and younger.
I am, yeah.
And I know several patients, Indian women, they're getting young thyroid cancers, breast cancers.
Exactly. Yeah.
It's really interesting. Do you think this is also related to insulin resistance, or do you think there's something else going on in that population?
I think insulin resistance is one of the components, but I don't think it's necessarily the central one. I kind of use these two terms interchangeably, insulin resistance and inflammation, which is our low-level activation of our immune system. So our immune system should be an on-demand system that helps heal injuries, protect us against infections. But when that thing is turned on at a low level hum continuously 24/7, it can activate all types of adverse processes, cancer being one of them. In my work, I try to separate those two out so individuals understand that process, but they are so interrelated. Insulin resistance is intrinsically an inflammatory process, and then having inflammation can actually beget insulin resistance. So the cycle can go in both ways. And when I look at individual patients and I take a detailed history and I look at lab values, often there's significant overlap between both. So, in many of my women, for example, they may not manifest with any specific signs of insulin resistance. All the typical criteria are not there. But I can see from their symptoms and some of their history that they've got a lot of inflammation that started at a very early age. This might be simple things like eczema, chronic migraines, seeing some thyroid dysfunction early on. And this is not something we can very easily diagnose. People might say, check a C-reactive protein or a SED rate, one of these non-specific inflammatory biomarkers. But really, a lot of it just comes from the history, just understanding that these are processes where the immune system is probably working in overdrive. So when I look at women or I see patients at an early stage, I'm already, we don't want to think about cancer by the time we detect something on a mammogram. We want to think about what are lifestyle factors that might be contributing to this. One thing I talk about with diabetes is don't wait for prediabetes. Catch it at prediabetes. If you've already got extra visceral abdominal fat, your triglycerides are mildly elevated, maybe even within the normal range, this is when we have to intervene. Same thing with cancer. Where are those early signs of inflammation happening so we can intervene as early as possible and not wait for that screening mammogram to pick up on an abnormal mass?
So true preventative care.
Absolutely, yes.
Looking at the root cause, whether it's inflammation. And you have to be careful because a lot of quacks online love to bandy around the term inflammation,
They do.
Right? But see, you actually take care of people who are actually inflamed.
Right.
And there are markers, right? C-reactive protein, other markers that
Yep.
you can measure that then go hand in hand with this vicious cycle that we're calling insulin resistance, but it's really a complex cycle. Now, what's interesting is in these young women in particular, we're seeing a lot of, and this was a big question when I put it out to the Z-Pack. I was like, hey, what do you want me to ask Ronnie James Dio? They were like, well, ask them about polycystic ovary, because it seems like it's rampant. And my own personal story with that is I have a very close relative who I won't name or say what their relation to me is to avoid embarrassment, because when they were young and we were growing up, she had facial hair and started to get obese after puberty, and irregular menses and moody and emotional and all this stuff. And, as a relative, we would all poke fun at her and be terrible and vicious bullies. And I still have a lot of guilt about that. And the truth is, when I look back at what this was, it turned out later she was diagnosed polycystic ovary.
Oh, Jesus.
Same genetics,
Oh my gosh,
South Asian, feel terrible about it, doing great now, metformin, had babies, doing fine. But at the time, no one could understand. And there were so many young Indian girls who had facial hair and body hair and these signs that now we know where this syndrome, which you don't even like to call polycystic ovary syndrome. You call it something else, which we'll talk about. But it was so stigmatizing that now if we can recognize it for what it is, intervene on the root cause, we can actually help a lot of suffering. Can you tell us more about this?
We should start a support group for guys that have a guilt over teasing girls that have PCOS. Really, I mean, it was amazing how even in our social circle growing up, there were a bunch of guys that teased girls that had facial hair and all this stuff, and we had no idea what was happening. There was just no awareness about this condition. So again, that's such a great example of trying to, you don't want to wait till the hormones are out of whack. This is something you can truly identify very early on. So I tell parents, because I see so many generations of families in my practice, if you've got a daughter, she's insulin resistant or has PCOS until proven otherwise, you do everything you can to stay ahead of that condition as much as you can.
So how do you do that?
So basically the nice thing is, again, when we learned about PCOS in medical school, we weren't really taught that this is a reversible condition that's primarily due to lifestyle, changes, right? Do you remember any lectures?
No.
Maybe you went to better school than I did. Maybe they taught you better. So
where'd you go to school?
I went to Tufts. So.
Dude, Tufts is a fantastic school. I went to UCSF, where they think they're better than everyone. This is true.
Right.
Okay.
I thought maybe they taught you the right information.
No. What they taught us was it's this typically irreversible but treatable condition that we don't know the etiology of it, but a lot of them actually have some degree of insulin resistance, and for some reason metformin helps.
That's exactly right.
That's what I was taught.
Yeah. So again, it's that whole spectrum. If early on you identify, and this is so critical, at the early stage, if you have a daughter, just making sure you're keeping track of her physical activity, her diet and nutrition early on can make a big difference. Now, for those of you even planning to get pregnant, this is really where you can already start making a difference, because as a mom, and many of the moms that I see that are, the pregnant women that I see in my practice, they're working very high stress jobs. They have no time for nutrition, and what they're eating at that time and their physical activity patterns is already going to dictate what sort of glucose tolerance, their future infant's going to have, basically, right? So if you can catch it even at that stage. So one of the things that I really love doing is when I go to corporate wellness programs, they sometimes invite me to give talks to pre-pregnancy populations. So couples that are planning to get pregnant. That's when you can hit it the most. If you can make them aware of these sorts of conditions and intervene then, I tell them, treat pregnancy like an Olympic event. You want to train for that event and not sit stagnant, stressed out, and eating the wrong types of foods, because this really starts in the intrauterine phase.
So intrauterine, you're actually affecting the child's glucose tolerance.
That's exactly right.
Yeah, and that's something that is a new understanding relatively, correct?
Yep, absolutely.
Because I was never taught that.
Yep.
and I think the theme of this whole talk, Ron, is this is stuff that we were never taught.
Yeah.
And so this is why I'm such a Ron Sinha fanboy, because you actually got woke enough to do something about it in your practice. And I know a lot of internists who just are either too busy or they're too conditioned to actually go, could we be missing something big that is a different way of thinking about this? And now it's this creates its own momentum. And the fact that we have the internet and social media to actually take physician voices and amplify them in a good way is great. Now we have plenty of horrible Instagram influencers and other quackopractors and others who are online selling us garbage, but there's a lot of and there's a lot of great chiropractors, say, who are focused on pain management and specific things, and they add a lot to the conversation. But we have so much noise in the system that it's great that someone like you is out there doing corporate wellness events, because those are the people who need to hear. They're the most stressed out people on the planet.
Agreed. Yeah.
What are you telling young girls or parents of girls with PCOS on how to manage and improve their condition if they have it already?
I mean, the high level message, I don't do the, sort of not necessarily the medication management, but I give them a nice piece of hope, basically, that this is something that is potentially reversible, that it is primarily lifestyle induced. And in many of the cases, when we see people make the proper lifestyle changes, we see a lot of those hormonal dysfunctions actually regulate. So I think that's really empowering news, because a lot of parents haven't really heard how much of a factor lifestyle really is for that. Obviously, there might be cases where you still have to use oral contraceptives, some degree of metformin. But if earlier they can get that message and make the right sorts of changes, it's huge. I don't like to use scare tactics, but I think it's very important for the whole family to know that PCOS can lead to a higher risk of future heart disease and diabetes. I kind of present that in a gentle way, so we're aware of the landscape of what can happen if we don't intervene now. But after we sort of set that stage up, we've got to give them empowering lifestyle choices they can make, and then give them things that they can track as they go along the way. If glucose is already a little bit off, if triglycerides are off, or if body mass index or waist circumference is off, what are the things that we can do to make a change? And let's monitor these monthly, every couple of months, stay on top of them. And you as a practitioner, if you're busy and you don't have time to do that, just the fact that you as a doctor can acknowledge that this is potentially PCOS, and instead of just referring to a specialist like an endocrinologist, can I get a dietitian or a health coach to work with them in conjunction with the specialist? So we have a lifestyle strategy that is as potent as a medication strategy as well. That's the way to sort of, take advantage of that knowledge.
And see, that's another thing that's pretty woke for most internists. So most internists are medicate first. Lifestyle's never going to happen.
Yeah.
And I think that's a sad capitulation. First of all, it's a capitulation to our broken system, which says we don't have the time, the resources, the autonomy, the tools to actually help patients with lifestyle. But you said a few key things: health coaches, lifestyle, nutrition, those kind of things. We can actually refer to that. We don't have to do it all ourselves. We take a lot on ourselves too. And this is one thing that you had mentioned, is like you don't want to use scare tactics with the parents. And there is an empowerment to saying this is a potentially reversible thing. If you just do the right stuff, you can avoid these things that can be harmful. One thing that I wonder how you address is that sometimes the parents are partially causative in this, in that they create a lot of stress, expectations. Maybe the cultural dietary stuff is there. Maybe there's an acceptance, like, oh, everybody in the family is hairy when they're adolescent. We heard some of that in my family.
Sure,
Oh,
yeah.
I had that when I was growing up. And how do you sort of manage that?
You bring up such a key point, because as much as we're focused on diet and physical activity, the stress axis, the whole family needs to understand that. And as we know, stress is intimately linked to sleep dysfunction. And there's so much great science now showing what a direct link there is between sleep deprivation, poor quality sleep, and insulin resistance. It has such a profound impact. I know Peter T has talked about this a lot. I've followed my patients' fasting blood sugars for a long time and correlated it with how many hours they sleep. But as we see teenagers who are stressed out, so now how do we connect the dots on emotion, behaviors, and metabolism? The way we connect it is if you're overscheduling your kids, if you're telling them to take 6 AP classes, do piano, do math, do all of this, and then they come home and they're supposed to do 2 hours of homework, what time are they going to bed? Probably midnight or 1 a.m. And guess what? That first half of the night is so critical for anti-inflammatory metabolic hormone production to really regulate your hormones that can influence glucose metabolism. So if you're creating an infrastructure, an environment, and a schedule that's pushing your daughter to go to bed that late, then it's really an uphill battle. You can do anything you want with diet and physical activity. Already we're starting the day when we wake up going the wrong way. So really important.
Oh my God, so much to unpack on that. And I hate that word unpack. It's such a douchey thought leader thing to say, but I'm going to say it. So yeah, I heard you talking about with Peter. We had Blair Duddy, a pediatrician, on the show talking about sleep and how crucial it is and how our schools start too soon. We have too many expectations on these kids, particularly kids who are gifted. They're cursed with high neuroticism, high expectations, big fear of failure, all kinds of stuff like that. What's interesting is like so there's such a culture, particularly in South Asians and Asian parents, and I know that we both know this from personal experience, both
Sure.
being a parent and being parented by these people, that there's nothing good enough. So if you tell these parents, you know what, the kid needs to get sleep because of glucose regulation and hormone regulation, then what they're going to do is they're going to go to the kid and be like, get to sleep because the glucose is, fatafat, you're going to mess up. Here, watch this TED Talk on glucose.
Yes.
Right? And it becomes now it's a competition for how soon you can get to sleep. Everything becomes gamified. Their stress level, cortisol goes up. Their sleep quality is bad. Their fasting glucose goes up. They become more insulin resistant. You know, how do you talk to these parents?
You know, the key thing is, I think what you're talking about is communication style with your children, right? And if we're always top down and dogmatic about everything, then pretty much your kids are going to push mute every time you open your mouth.
Wait, is there any other way to be? Because, I mean,
I know, right? Not the way we were raised,
not the
right?
way we were raised.
Right,
Yeah.
But really, if you want to make a move with this, I mean, there's two types of kids that I'm seeing in Silicon Valley. Some will listen compliantly. They'll nod their head just like you did right now, and they'll be very quiet. And sometimes we think that, great, that's such a great kid. That kid is so polite. He listens to everything. But a lot of times these are the kids that are suffering the most because they have not developed the ability to actually express their emotions or talk to their parents and share things. They're basically working in a company where mom and dad are the boss and I'm basically a ground level worker, right? Then on the other hand, you've got more of a conflictual relationship with the parents where there's a lot of adversarial things going on. And that's also not healthy because anything the parents say, the kids aren't going to listen to. So we got to find some middle ground where we can actually optimize communications, develop trust in the system. So then if you do give little pearls of advice and then you're mimicking those pearls by you not staying up till 2 a.m. looking at your phone, then those are the things that can create more shifts.
Oh, man. Yeah. Okay, let's keep going down this path because this, to me, as a parent, is now so fascinating. And we've talked about the book, Coddling of the American Mind, with Jonathan Haidt. You talked a little bit about it with Peter. I want to go deeper down this whole of parenting because particularly now, okay, we have this whole idea that we're over-parenting the kids and we're coddling them and we're keeping them overly safe. They're not taking risk. They're not having unstructured free play, all these other things. And we're seeing that as a fragility. So what's happening is children are normally what they call anti-fragile. Nassim Taleb has this term, anti-fragility, meaning it's a system that gets more resilient and stronger the more you stress it within tolerance. So as long as you don't break it with an adverse childhood experience, in other words, there's a molestation or some terrible sexual abuse or a physical violence that will break that child's resilience. If you stress it within the tolerance of that, like let it go out, let it. Suddenly I'm already objectifying. This is such a doctor thing. Let this organism proceed to the tree where it shall fall and injure itself, but not severely. Just enough to stress the system that it realizes it can take risk. Here's the limits of risk. Here's my own resilience and strength, and they get stronger. What we do now is we force our kids to watch TED Talks on resilience so that they'll have the tools, and then tell them, you know what, the only way you're going to succeed is by kicking ass in college and doing really, really well and crushing the MCATs and the SATs and all of this. And so it's a mix of over-parenting, turning them fragile, with over expectations, burning them out and costing them sleep. And it's this vicious stew that now I think is leading to what we're seeing is an early chronic disease. You're seeing hypertension in teenagers now. It's
shocking.
It's crazy.
Yeah.
And so you have techniques that you talk about with parents and that you do yourself, like sitting at the table. I heard you sit at the dinner table and you talk about your day in a vulnerable way. Like, well, who does that?
Yeah,
seriously. Are you trying to show weakness? Never show weakness, okay? I'm telling you, Babu, don't do it.
I know, seriously.
Yeah.
I know. And, you know, just for the audience, they're wondering, how did we go from talking about insulin to all of a sudden parenting, right? And why did I get involved with this? Was my book not selling or what's happening here?
The South Asian Diet Solution, which is a fantastic book. We'll put a link in the thing.
Yeah. But really, I mean, the reason for this is because you and I, we're all about root cause. So I have so many educated people that come to see in my clinic. They've read my book. They've looked at all my resources inside out. They know everything about insulin, but they're still not making a change. So then I'm like, okay, why, with all this content and knowledge, are we still not able to make changes to reverse your chronic health conditions? So then you start thinking that, okay, there is something about the way they behave on a minute-to-minute basis. You know, they have an opportunity to eat this food, to walk, do this, but they refuse to do it. So then we got to step back and think, okay, how were we raised? Was health not a priority in your family growing up? Like, were your parents physically active? Did you play some sports? Like, what's leading to that? Because if we want to really kill this at the root and not deal with these sorts of issues at such a rampant rate, we've got to look at the emotions. And it really, in a lot of my talks, I tell people, I think insulin resistance is an emotional disorder. You know, even more than
snap.
metabolic, right?
You mean it's all in my head, bro? Because you can't tell me that, because I need a medical condition that I can treat with a pill. Because you start telling me that it's in my head, I'm going to react and project and get very angry, right? Do you get that response?
I get that sometimes. Yeah. But, you know, again, just like I do with my kids, when individuals come to see me in the clinic, they see an Indian male. So they assume a lot of things about me.
A very handsome
Thank
Indian.
you very much.
You know what? You look great.
That.
I'm not just blowing smoke.
Yeah, props to the makeup people in the back. But basically, they look at me and they already expect that, okay, here's an authoritative Indian physician male figure. So this is where, and this has evolved for me because maybe I was at 10 to 12 years ago, but I will lay it on the line. I'll tell them stuff like, you know what, I struggled when this happened. Like when they tell me, you know, my in-laws are visiting for 6 months, I was like, I hear you, man. I know how tough it can be when you've got family in the house and all this happens.
Chest pain just hearing that.
Right?
Yeah.
You know, but little things like that, if we can open up as strong Indian males and say that, you know, we feel this too. Because, you know, a lot of people have the impression by looking at sort of the work that I've done that I'm leading the perfect life. Like, Dr. Ron doesn't have chronic stress. Obviously, he's meditating every day. He's eating all the right foods. Hell no. Every day, I'm trying to figure out ways that I can make my bedtime correct, or where am I going to squeeze that workout in? So it takes effort. And I think as health leaders, if we say that it's an easy process that everybody should be able to do, we're doing a disservice, right?
Yeah.
So if we can show that vulnerability and how we sort of got around that and teach those tools in a methodical way that are actually achievable and not give them a list of go to bed early, meditate, eat healthy, and exercise, which I used to do back in the days. And then patients just hit mute, right? By the time you've hit the second or third thing, I think that's really key. I don't know if I went off topic on what the
that was
question
exactly
So,
what we're talking about. And I think a piece of that is this emotional piece. That's what really resonated with me when I heard you on Atia, and you guys only really glanced the surface because you talked about the deep metabolic stuff.
Sure.
The deep psychosocial component of this is an ingrained unconscious level of stress. And it resonated with me. And I think you said something about talking about ourselves a little bit, right?
Yeah.
And you had insulin resistance. Like this was something that you suffered through. You had all these problems. You were gaining weight, eating what you thought was the right diet. You found the way, but you're still working on it.
Yeah.
I'm in the same boat with you. And we have slightly different genetics because I'm a Zoroastrian. We're technically Persian, but the family's been in India forever. So if you do the 23andMe, I'm 10% South Asian, 90% Middle Eastern by genetics. But I behave very similar to an insulin-resistant South Asian.
Yeah.
But I have no inflammation, which is interesting.
Okay.
So at least there's that.
Yeah.
And my family does tend to do pretty well from a coronary disease standpoint, not so well from a stroke standpoint, but I'm digressing. The point being, when I was young, the expectations of the parents were so fierce, right? But it was unspoken.
Yeah.
It wasn't even because they were so busy. They were just like, it's just understood you're going to achieve. I went through all of medical school, most of college, having to wear get the industrial strength aluminum deodorant because otherwise my pits would be it would be like this, like a full circle. And I didn't feel stressed really, but if I ever took my pulse, I had a PVC like every fourth beat. My resting heart rate was probably 80, 90. And so all this physical manifestation of stress that on the surface I denied, I'm like, this is easy. I sit in the back of the class. I don't do anything.
Yeah.
I study the night before. P equals MD, right?
Right.
Like you pass, you're good. But deep down, this was taking a severe toll on my health.
Yeah.
And it kind of comes to your heads in your late 20s, 30s when you start finding signs of insulin resistance, hypertension, these other things. You're like, what the heck?
Right.
And it took a total revamp in understanding. It took talking to compassionate people, including Peter Attia, who was one of them, and people who just kind of understood, no, this is actually, there's a lot of this is driven by the cortisol and other things that happen from stress. It's not a mind-body connection, I don't think, Ron, anymore. I think it's mind-body. It's like one continuum.
Yeah.
So how is it, because it's hard to address this with patients when they're so resistant to the mind component of it.
So this is where so you're right. There are some individuals that have a little bit of a connection to the mind part, and that's an easy sell because then we can talk about what things we can do. But I've got others that basically they'll refuse to meditate. It's too woo-woo for them, like you talked about in the beginning. And this is where you brought up a very interesting point that you could feel a PVC on your fourth heartbeat, right? So what are some physiological manifestations that we can maybe use technology to track? And this is where I teach people, a lot of my individuals, even though they're wearing an Apple Watch or Fitbit, they don't know what their average resting pulse is. I'm like, do you know what your heart rate is when you commute to work or when you're sitting in a meeting? And they have no clue, right? They're only checking their heart rate when they're on their elliptical machine, when they're exercising, if they even do that. But what is your average heart rate throughout the day when you're doing these stressful situations? And just give me feedback on that. And that to me was really powerful powerful when I started doing that a few years ago, because I thought that during this meeting, things are okay, or during this drive. And I found that often my heart rate, although heart rate can be variable for other reasons, my average heart rate was much higher than I thought. I think I was internalizing a lot of work stress, or maybe thinking about the family. And then as I sort of incorporated breathing techniques throughout the course of the day, during meetings, during times where people can't even tell that I'm doing this, I was able to bring my average work and commute heart rate down. And I could see that objectively on my Apple Watch. So I'm trying to use a lot of left brain tactics to introduce people to how breathing slower, how mindfulness can help them. And once they feel better and they're like, wow, I don't forget stuff as much, I can perform better, my sleep's better. Now that's sort of the gateway drug. Now I can get them into, if you want to go even further, maybe doing some seated sessions, etc., might work. So that's one way I kind of introduce it to skeptics. And then, of course, I have so many people, we talked about, you said earlier, that if their bedtimes are off and they're stressing at nighttime, their glucoses go haywire in the morning. When they start doing that and they see their glucose numbers improve, even their morning blood pressures improve, now they bought into it. So if we can attach some sort of objective number to that behavior change, can't always find one, usually you can, then all of a sudden you can pull them along into the right side.
Yeah. So you can motivate them emotionally with the kind of stories of the benefit, but then you really need to direct their little rider and say,
that's right.
You know what, here's ways you can measure it and you'll see it in real time.
Yeah.
And Peter talks about this using continuous glucose monitoring, and how, if he's stressed or if he's like not sleeping, he sees an immediate effect on his glucose. It bumps up.
Yeah.
And, over time, that's going to potentially be damaging, although we don't really know, right? It's still early, but at least it's a number that correlates to a physiologic response to stress. Blood pressure is another interesting one. I myself find that, I had a continuous blood pressure monitor, a finger-based one. We were doing a show for a company called Edwards Life Sciences. And during the show, it was a professor from UC Davis was teaching me about intra-op continuous blood pressure monitoring and predictive algorithms that can actually use AI to predict right before you're going to become hypotensive. So the anesthesiologist could respond, because there's some correlation data that if you dip your blood pressure too low during the OR, you have bad outcomes.
Right.
And now, again, we don't know that it's causative. So he was teaching me about this. I had the monitor on. The sales rep who was monitoring the device, I could see him in the corner, like kind of panicking. And I found out, afterwards that, my systolic blood pressure would get to 220. My diastolic would get to 180.
Seriously?
Yeah, seriously.
Whoa.
During a live show.
Wow.
This was a live show. Now,
Okay.
I felt, in retrospect, I remember feeling like, and why am I telling this story? It's not about me. I'm telling a story that people don't realize.
That's exactly right.
That they're harming themselves. So during the show, I remember feeling some heaviness in my chest and a kind of a general tension that often I would associate with being live and the energy of being live, and how awesome it is to go live, especially in a strange place with strange people, to hundreds, if not thousands of people. And I always thought this is just second nature for me. But my unconscious mind is like, you are in fight or flight, gonna die mode. There is a tiger ready to bite your head off.
Right.
And it manifests that way. Now, if I do that consistently, I'm going to have lacunar infarcts. I'm going to get early dementia or a stroke.
Yeah.
And it helped me. That measurement helped me understand what was going on. So now before I go live, I already kind of get into a mindset where I'm like, this is not worth dying over.
A really important point. So what you're describing, and same thing with me, like my resting heart rate is about 50. And when I do talks, I've actually monitored it. It doubles. It can go up to 100 or 110. Okay. And that doesn't mean I should quit sort of doing, speaking gigs and things like that, because it's kind of like exercise, right? If we exercise intensely, blood pressure, heart rate are going to go up, but we're looking for the long-term gains of that, right? It's going to have positive, beneficial vascular effects, all the great things that happen with exercise. But when I started seeing this impact in my body, what I realized is I needed to make a schedule shift, because normally I'd go out to a company, I'd give a talk, I'd race back into clinic to see patients, and seeing patients raises my heart rate as well too.
Oh, hell yeah.
So I basically had to make sure that I need to schedule in some space. Like if I'm done giving a talk at a high-tech company, I'm not going to immediately go back and see the next slot in my patient's schedule. I'm going to walk around the corporate campus, come back. I'm going to actually come back and do some slow breathing, bring my heart rate back down. Because really giving talks and doing the work that you do, it's energizing, right? I think it has health benefit because we feel like we're doing good.
Connecting.
But if, exactly, we're connecting. But if immediately after that, you're doing adrenaline driving activities after that, then it is going to take a toll. So I think all of us have to look at our day and say, what are the things that energize us? But are we creating spaces for us to calm that nervous system and that vascular system down? That's really key.
And if you get a headache after your talk, if
Yes.
you get in, and I used to do this,
Yeah.
you know that you're probably hitting you're probably
That's
hitting a
absolutely
high
right.
blood pressure. And
Yeah.
you made an important distinction, which is when we exercise, yeah, our blood pressure and pulse can go up, and these things can happen, but we're coupling it with an opening of the vasculature in the muscle beds,
Yeah.
creating a decreased peripheral resistance in that way. And that's very beneficial long term. If you hit somebody with high blood pressure and high pulse rate and you're just sitting there, that is very, very, very long term bad. And again, it doesn't mean you stop the things you love to do. It means that you do things like you said. So it's funny. I remember still like TED-Med 2013, the Washington Kennedy Center. I'm the last talk of the day, and everyone's expecting me to like, oh, this funny doctor is going to come, and he's a rap doctor, and he's going to make us laugh. And so I am stressed. Like, I had to introduce Richard Simmons, which was weird, with the Surgeon General. The whole thing was kooky, and Richard is, a little bipolar-ish. And so I was super stressed. So before I went on stage, I just did one thing, and I said, you know what? I'm in the present moment. It's a gift to be with these people and get to connect. What a wonderful I'm at the Kennedy Center. Took a deep breath, and you see me on stage do it. I just go, and then I start to talk, and it reframed everything. And afterwards, I didn't have a headache. I felt great and all these things. You know what amazed me is you said you go from a talk and you just go and see patients after that. I couldn't imagine that. I'm so spent. I'm just done. I'm like, I can't talk to anybody, and yet I do.
Yeah.
But it's really...
I mean, my day, I tell people, it's kind of like interval training, right? So you've got these events where you're spiked, and before it was just spiked the whole time, but now that I've incorporated, and literally sometimes, honestly, I mean, thank God for little power naps. Sometimes I will be in the car, it's quiet, I've got calming music on, I might have a calming app on, and then for 10 to 12 minutes, I just shut down, and then I'm recharged again. But, when I take a lot of my patients' histories, moms that are busy between work and picking up the kids, there's no downtime at all. It's a continuous, and they wonder why they're developing autoimmune conditions. I mean, the body's literally telling them that you're not resting at all, so we need to be in high alert mode.
Oh man, let's double down on that. So a lot of our audience are nurses. They are the nurturer phenotype.
Oh, yeah.
They give up everything to take care of others. A lot of them have been traumatized when they were younger. And so they have this thing where I can help others and thereby heal myself. And I hear from them the stories of autoimmune disease, rampant hypertension, young strokes, PCOS, young cancers, all these kind of things. Is this the same phenomenon that we're seeing?
It's similar, yeah.
What would you tell nurses? They have busy shifts. They're expected to do more and more with less and less. Give us a magic bullet, Ron Sinha.
I wish there was a magic bullet. But what I will tell you is it comes back to my principle of how do we incorporate healthy practices during work hours? So with stress, for example, one thing that's really helped many of my patients and helped me is really just a regulation of breathing. So one simple tip I want to give you is a lot of us that are sort of mouth breathing throughout the day, if we simply during quiet moments closed our mouth and we breathe more through our nose, so nasal breathing, that will automatically help regulate your nervous system. If we go beyond that and do a practice called nasal humming, believe it or not, so if you like music and you basically hum a tune and you go like that, that actually has additional benefits. So again, for you left brain skeptics out there, they did a study where they used functional MRI imaging and they looked at brain scans of people sort of making different sounds to see what impact it had on the brain. And so they had people literally do the humming sound, the and what they found is as they hummed, the limbic system, the midbrain, all that overactivity actually shut down. It got dampened by that specific sound versus if they were saying s or some other consonant sounds. So I've actually taught some of my patients to nasal hum. I'm like, you're in the car, just hum. And do that throughout the day. Nasal breathe, don't breathe with your mouth. And although we're not removing the external stressors of having a terrible boss or financial situations, they find that they can navigate things and just be much more calm throughout the day. And if they're tracking their heart rate, they find that gets better. And and often with even background sounds, I'm actually literally sometimes charting in an exam room and I'm nasal breathing or I'm nasal humming while I'm doing it. And by the time I hit my second half of the day seeing patients, I'm in a totally different zone.
Dude, okay, I'm sure it activates a parasympathetic nervous system and this sort of this kind of calming thing, but that's the most annoying thing I've ever heard, Ron. Could you imagine like Sharon's at the nurse's station and she's like, I said, yo, what a concept. No, but actually, all joking aside, that's a really cool, interesting tip that I hadn't heard.
And it's something, if you're too embarrassed to do it, obviously in an exam room, I tell people my car is often my stress release chamber.
There you go.
So the commute is key. If you love music, play music, and sing as loud as you can. Even if you have a terrible voice, sing as loud as you can, because what are you doing? I'm sure you are.
You've developed,
and you're activating your diaphragm, right? So at least sing. I have like old 80s tracks I listen to. I'll sing my butt off on these, so I can just activate that diaphragm.
What's your track of choice? Come on, dude.
Oh man,
bring it. Give me some Def Leppard.
Def Leppard is definitely one of them for sure.
Do you take sugar? One lump or two.
Right.
So just singing at the top of your lungs, that diaphragmatic parasympathetic activation, vagal nerve.
Absolutely. Yeah. So what I love about your line of work is that's part of it is music. The second part is laughter, right? So listening to podcasts, whatever you can in the car, and laughing even louder than is necessary to activate your diaphragm, because all of us are so contracted, right? We're in front of a computer, we're seeing patients, our diaphragm is contracted, we're breathing up here in our chest. And when I get in the car and I've had a stressful day and I gotta go and be a parent at home, often I am doing release techniques in the car. I get in the garage, I might do some nasal breathing, or before you walk in as a busy mom/nurse, maybe you need to take a walk and just do some slow breathing before just going from a high stress job right into that environment. So think about some of the things that you can do there.
That's really great advice, you know. And the other advice I've heard you give, which I thought is great because I try this myself, is look, you may not have time to do 30 minutes of mindfulness meditation and that the wellness people at the office are telling you, and you know they're trying to sell you this thing, and you're like, wow, come on, man, they're just trying to get more RVUs out of me, right? Right. But what you can do is take some of those techniques and spread them out throughout the day. Like you said, it takes just a minute to do some deep breathing as you're in a meeting, about to start a meeting, you're about to take report. You're about to give sign out. You're about to pick up the phone and Bill's about to sign out a train wreck service to you. And you're like, okay, the world is short. Okay, maybe not that, because Smash Mouth has been clinically proven to raise blood pressure in 9 out of 9 human beings. So actually we kind of tipped on this thing. Healthcare professionals are not a healthy bunch when it comes to stress. And we're all having this really difficult time where, and I actually, you know, I did this rant on moral injury and how it's not burnout, it's moral injury. And yeah, that's true. But you cannot externalize it too much. So by saying the system's broken and it's causing us this moral injury of having to work in a system where we can't help patients, we can't take care of our families, we have too many bosses, we're inclined to have to please the corporate masters, the malpractice people, the lawyers, the patients, our family, ourselves, Indian dad who's got all these expectations, and it creates this conflict that leads to depersonalization, low feelings of achievement, depression, these kind of cynicism, these kind of things that we call burnout. I did a rant about this and it got quite a lot of play. The one thing I want to mention in follow-up is, but you're then you're removing the locus of control from yourself. And I think that's harmful. You have to make sure, there are these systemic problems. Until we fix them, the problems will persist. But there's too much work, there's too much self-imposed stress, and we feel like the way we treat that problem is by working harder. And so there's a lot of internal dysfunction in our ability to be resiliently responding to this dysfunction that harms us. Do you agree, or how do you think about this?
I think you're absolutely right. And as much as we're putting this in the healthcare environment, you know, talk about Silicon Valley again as well,
tell
too.
me more about this, because this place is miserable.
No, I know. It's tough.
Actually, let me interrupt you for a second.
No, please, go ahead.
Because I have been in Vegas for 7 years. I was happy. I was content. I found a passion and a purpose and a team and connection. But at the same time, my friends and my extended family and my professional network are back here in the Bay. And we kept this place and we said, well, let's go back now because we want to reconnect in this path. The minute I got back here, a misery descended on me. There's something about this place that causes this expectation of striving and accomplishment, and why am I not making more videos, and why are we not out there doing this, and I'm yelling at my team and I'm losing my temper, and I'm worried why my daughter is in an advanced math when she crushes it everywhere else, and I'm losing my freaking mind, Ron Sinha. Now, is it this place? What are you noticing in the Silicon Valley, or is it a mindset that can be anywhere?
It's a mindset that can be anywhere, but it is true that in Silicon Valley, the individuals that come here to do great things, whether they've come from any parts of the world, they've read the, Fortune magazine covers, they've seen that if I come here, I can start a company just like this person that came from the same village. So you already come in here with sky high expectations for yourself and for your kids as well, too. And here's where the parental stress comes in, because we know the majority of people who move here are not going to become Elon Musk, right? So it's just not going to happen.
You shut up, Ron Sinha. Okay?
Sorry.
I'm
You're
going
on the
to
way.
Mars, and I'm going to do it in an underground tunnel. I'm going to build an underground tunnel to Mars, okay?
Right.
But you're right. We're not.
We're not. And then when we don't achieve that, so let's say you and I worked at a company, okay? We both work at a company. We're great friends. You on the side, you've got a side hustle, okay? You're doing some sort of startup app. And I'm like, yeah, whatever.
It's essential oils, bro.
Yeah, essential oils. There we go, right? And so we're doing this work, and then all of a sudden, you hit it big. And as much as we're close friends, you hit it big. I've got some envy going on, right? So how did Zubin make it so well? And I'm still working with his company. I'm still stuck here. I'm going to hear this narrative over and over. But guess what? We also have kids that play together. And they love each other. They're great friends from early on. And all of a sudden, your kid's doing, like, let's say, an entrepreneur boot camp in the summer. They're playing this sport. Then I subconsciously think, you know what? I want my kid to sort of do this or up it, because you beat me in the game, but maybe my kid can beat you in the game. Because the way I can beat you is by telling you, guess what? My kid goes to Stanford and yours doesn't, or my kid goes here, right? So we need to acknowledge the fact that a lot of us are living on the coattails of what our kids do. And that's providing so much unconscious stress. So one thing is, number one, when we come here with high expectations, acknowledge the fact that we're not always going to meet those expectations. We have to, I think the biggest lifestyle change for me has been to, on a daily basis, lower my expectations around everything that I do. And that might sound like I'm not motivated, but literally that means that, if I'm giving corporate talk in the early days, I'm like, why aren't there 1,000 people here? I put my time aside. But now I'm like, even if one person shows up, what an opportunity for me to connect with one human being and make a change there. I go to a restaurant and I'm like, you know what? Thank God I'm in a restaurant and people are actually serving me food. They're waiting on me, for God's sake. If the steak doesn't taste good, who gives a crap, right?
Yeah.
So everything, and it was a practice for me, but once I started doing that, and I remind my engineers and people that come in, is there is someone like you in India right now that would kill to work at a company where you've got, on-site hair cutting, massage, everything.
Shit,
and
I'd
you're
have
sitting
worked
here,
at-
right?
I'd kill to work at that
exactly.
company,
And that's a key thing. So when I see doctors, because I have a lot of doctors in my practice, the ones that are burned out, they tell me, I wish I worked at a high-tech company. I wish I worked I'd be so much happier.
Oh my
I'd have
gosh.
everything served. We don't even have a gym in our, they have gyms, they have everything. In the meantime, I'm looking at the health claims of, all these corporate companies at a mass scale. Mental health disorders are at the top of the list. The number one prescription being prescribed are antidepressants. And sometimes I'll see these high-tech workers and they're like, God, you know what? I sit in front of a computer all day. I wish I went to med school. It's like, so it's that if then, right? It's like, if I had done this, maybe if I stayed back in India, I'd be happier because I'd be with family. Maybe if I moved out of India and went to the West, I'd be happier. Maybe if I became an engineer, we keep playing these scenarios in our head. If I moved to Vegas, if I moved back here, but there's no 100% happiness solution, right? So I think if we know that all sides are suffering, and to me, that's kind of the connection point, is everyone's suffering. People at the top of the food chain in corporate America, people who are doctors, nurses, but how do we sort of share our suffering and try to heal each other? I think that's the key thing.
Oh, man, that's a ride you took me on, man. It feels so true. And the thing is, having this jarring return, because before I left, I was this way.
Yeah.
I was a striver, and it's a hedonic treadmill. If I could just do this, and and then you hear Dad's voice in your head, if only, he always says, if only I had specialized, if only. And then that ingrains in you, and you're like, well, everything has always got to be a little bit better. Yeah. Oh, we did a remodel on the house, but there's a nick over there now. So whereas, when I was in Vegas, actually, it was interesting because the environment was different. It was a blank desert slate. So you bring to it what you want to bring to it.
Interesting.
And I got woke early on there with a friend who just was like, this is what it's really about. It's about the present moment. It's about, here's some books you can read. Here's some stuff you can learn. I'm like, what? There's a present moment? You mean there isn't just worrying about the future and striving towards it and regretting the past? And it's blissful. And I get that back here when I meditate, but then I lose it during the day because there's something about, you know what it is? It's the collective culture of it.
Yes.
And you can get sucked into it. And I think people need to realize that, what you just said, that everybody's suffering. The person you think is the happiest, that's rich and doing all these things, is on antidepressants, is stressed out, has early onset coronary
And
disease.
that really was an awakening moment for me because of the work I do, I take care of a lot of execs and entrepreneurs. And these are people that other people in communities would think, I want my kid to be like that person.
Right.
I take care of the families. So I know the second or third wife as well, too.
Oh, my God.
I know like all this stuff that's happening.
Right.
And to me, I'm like, if you had a choice right now and I asked you for your kids, would you rather have them be, I'm not saying there's a black and white, but just as a thought exercise, would you rather as a parent have them be a super successful entrepreneur on the covers of magazine that you can brag to your friends about, but their health is a mess, their marriage is a mess, they're emotionally a mess, versus somebody that doesn't have a Fortune magazine front cover job, maybe not as respectable of a job, but they're living a fulfilled life? Great marriage, no health issues. Which one would you choose, right? And that's the thing, because if we're pushing somebody in a direction of achieving that reputation status profession and they're sacrificing their health, I end up seeing the parents of those entrepreneurs, because I often take care of 2 or 3 generations, and they come back and tell me, why is he still working so hard? He had a heart attack. Why is he not slowing down? And that was a really compelling point is I saw a female patient see me who had a heart attack at age 45, and she was in there with her parents. And basically the parents were saying, I can't slow you down. What's going on? You had this heart attack. What's happening? And she just said something that just stunned me. And that was a revelation to me. She was like, you guys never taught me to slow down when I was young. You told me to be the best. We never talked about rest and things. So that's the way I am. And when I heard that, I'm like, my God, I'm already, the way I'm parenting my kids, the way I'm raising myself, if I'm creating that sort of a wheel where they don't know how to acknowledge and slow down, then, what have I done as a parent, right? Other than create a profession for my child that I can brag to my friends about? Is that really what the purpose is?
It's absolutely it. And, I'm doing my best to stay focused on a practice and a philosophy that I developed over 7 years. But it's amazing how quickly it can regress.
Yeah.
And so you have to be mindful all the time.
All the time.
It's funny, you told that story about your patient. So I took care of a VIP patient, name, sex, all that can be withheld.
Yeah.
This person is one of the most successful people around, and by any stretch of the imagination. When this person's parents came in the room in the hospital, they were hooked up to a Dynamap. Pressure had always been normal. Pressure was 180, 190. Just talking.
Jeez, yeah.
Looked like a calm interaction. But the unconscious stress.
Oh, yeah.
And you said something on a TS podcast. One of your talks is called Your Children as a Startup.
Yeah.
Is
your child a startup?
Is your child a startup?
Right.
Explain that, because
Yeah.
it resonated with me.
Yeah, I think we do treat a lot of our kids like startup companies where we back them with all types of finances, resources. We set sky-high expectations. This is a child that, I work at this company, but my child someday will hopefully run a company like this. And we have so many expectations on that kid. To me, it's no different than investing in a startup company. But we sometimes forget that, this is a 10-year-old kid. This 10-year-old kid doesn't have to give a TED Talk when they're 14. They don't have to go to entrepreneur camp. They don't have to do this. They just have to be a random kid. I like how Peter talked about the fact it's true. What do we do as kids and teens? We're just messing around all the time. And although that might seem technically like a waste of time, it allowed our brain rest. It allowed our body to grow properly. So then later we can kill it, right?
Yeah.
So,
Yeah.
at least you're conserving energy. But right now, we're burning out kids by treating them and expecting that they're going to operate like adults. Now the expectation really is when you apply to colleges around here, okay, did you start a non-for-profit? Did you start your own app, or did you already launch a company? Literally in Palo Alto and other areas, that's the expectation, is my kids should have already had a startup. Some of these kids are already selling their first companies with a lot of parental assistance, but it's crazy. So, and even though I'm saying all this, every day it's a struggle for me too, because I've got to reset my thermostat. But the key thing that you mentioned is even if you can voice that in your head and say, there's my unconscious dad telling me this again, or sometimes like, there I go, type A Ron again. If you can externalize that and watch that just as an observer, that still helps the situation rather than just go through this rat race completely blinded, right? And I talk to that about my kids because they have some friends around them that are just such type A achievers.
Gunners.
I'm like, they're gunners, right? That's the word we use. And I'm like, you know what? Don't feel, this is what's happening basically. I was like, and we sort of characterize it as like, what do you think their cognitive behavioral pattern is? We sort of do a little psychobabble, but I like to have them step back and sort of feel this is what's happening. And they sort of know the types of patients I have to take care of. And, I'd never wish any harm upon anyone, but I'm like, if that individual doesn't learn to slow down, they're on a race to basically poor health later on. So I think pausing and stepping back is really key to be able to watch that as an outsider.
Yeah, I think you nailed it. Last night I had an experience. So I was putting my 8-year-old to bed, and she's a gunner. She's a little gunner.
Yeah.
She's like really good at stuff and and I don't push her because she automatically pushes herself.
Yeah.
And she was telling me, and she's laying in bed. We read like Diary of a Wimpy Kid, and she goes, "Daddy, should I do what mommy does when I grow up? Should I read x-rays and things like that?" Because mom's a radiologist.
Yeah.
And I'm like, why are you asking me that? She's like, I need to know what I'm going to do. I need to be able to
Wow.
make money or I'll be out on the street. Like, I need to do that. I'm like, you're 8. Like, first of all, awesome thinking, kid.
Right,
I
right.
like the way you're thinking because
Yeah.
you could be on the street at any time. I like to instill this sort of general that nothing is taken.
Right.
That's an Indian thing, too. At
Absolutely.
any minute. Fatafat, you're on the street.
Right.
But at the same time, I told her, you're a child. I want you to think about being a kid. I want you to go out and play with your neighbor next door and have fun in this beautiful part of the world we live in. I want you to eat fun food and hang out with daddy and not worry about this stuff because there'll be plenty of time. I told her, there's 10 years before you need to even think about what you're going to do with your life, all right? And but if I didn't have the little bit of wokeness that I have, where I was like, because an earlier me would have said, I'm glad you're thinking about this. Okay,
Yeah.
here are the different options.
You would be ready to monetize her on the moment, right?
Immediately.
You're like, yeah, totally.
I'm like, you know what? I know a guy who can code. This
Right.
is what we're going to do. We're going to create an app for kids.
Exactly.
It's called Doc Goose. This has been my idea for an app. It's a dating app for medical professionals. Doc Goose. It's only doctors on there. Because we know doctors should only date doctors.
Oh, God help us.
Yeah, and yes. So that being said, I think it's important to have that. One thing you also talked about with Peter a little bit that I wanted to follow up on was the sports thing in Indian populations and immigrant populations. A lot of times, that population didn't grow up with organized sports beyond a little soccer out in the thing. And my dad recently told me this story. So my dad he's turning 80 on Monday, and I'm going to Fresno, Clovis, where we're from. Actually, they still live on Demania Manor.
My mom's in Bakersfield. I used to go to Fresno all the time.
Your mom's
for soccer
in
matches.
Bakersfield?
Yep.
What
I did
the-
a lot of my
Dude, who was your high school?
West High.
West High.
Yeah.
We
You
were
know that?
Clovis West.
Oh, look at that.
Yeah,
Yeah,
so
we
we
had
would
some football.
probably
Yeah. We did
Now,
interact,
I
yeah.
never did sports. So what would happen? So I never. My parents never taught me sports. My dad never taught me to catch.
Yeah.
I did do a little soccer, which was interesting, and I ran, and I was always active. So I did skateboarding and that kind of thing, but never organized sports. Always ostracized in a community that was all about sports. So a bit of an outsider, chubby, all the other stuff. So I find out from my dad, because now that he's 80, he's telling me these stories. Like, I never told you how I grew up. And he grew up in a British boarding school outside of Mumbai, and that his parents sent him to because his parents were super poor. But because they were, Parsis, they were Zoroastrians, the British loved Zoroastrians for some reason. So they took them into this boarding school and would give them 3 meals a day. And it was basically like a little rice. And if they were lucky, they'd get half an egg or something like that. And everybody played soccer, but nobody did any other sports.
Yeah.
And they had to sneak into the theater to watch a movie. The movie was the biggest thing in the world. Now I look at him, he's got this big 100-inch TV and he's obsessed about movies. He hates sports and all this other stuff. I'm like, this is like ontogeny recapitulating phylogeny.
Right,
Like the
right.
generations go on. And
Yeah.
a lot of these Indian kids come here the parents didn't have organized sports, but the parents now see sports as a competitive tool.
Oh, yeah.
And so what have you seen in these kids in sports? It's
Yeah,
interesting.
you're right. It's a competitive tool, and it's a way that people really get respect, social respect in communities. I mean, even here in Silicon Valley, which is so academically driven, I mean, people love the attention their kids get when they've performed in sports. And so a lot of the immigrant populations find out, because, I've talked to a lot of parents, and often they feel socially isolated when they come here, right? They have a tough time mixing maybe with non-Asians, but they find that, wow, if we show up at basketball games, soccer matches, this is a way to sort of assimilate and integrate. And at the same time, like you said, develop competitive skills, leadership skills as well too, that we didn't. So, but I do want to say that as much as we focus on sort of South Asian and Asian, people ask me, is this just a tiger parent thing? And I would say in high performing areas like here, Silicon Valley, New York City, Washington, DC, it doesn't know any race, right?
Yeah,
I mean,
it's
all
everybody.
ethnic, everyone's a gunner, and some people are super gunners with sports. And as much as you can justify in your head that, well, that's good at least because they're exercising, I actually would argue no. I mean, yes, the exercise component is maybe to a certain point, but if you're going to so many practices and events where you're basically eating junk food on the way there because mom and dad don't have a time to get a healthy meal, again, you're compromising homework times, you have to come back and go to bed late. A lot of these kids aren't growing. This is just an anecdotal finding, but I've talked to a lot of PE teachers and coaches, and they find that a lot of individuals are becoming very vertically challenged despite having taller parents. And my theory on that, and I see this in all ethnic groups, is because you've got a specific bucket of nutrients that are diverted towards growth, that are dedicated to growth. And if on a daily basis you are exercising so much that all those nutrients are going towards energy production and you're not allowing proper rest and sleep, you're probably going to take a hit in inches along with other areas of your health too. So again, coming back to the main point, I think everyone's a gunner in some way, but in certain parts of the country and world, that's on steroids, basically. Just depends.
So this idea that, it's interesting. So these kids are really good at sports. They're exercising all the time because their coach is making them train and stuff. They may be losing inches of height potentially. Who knows, right? Like you said. But what's interesting is when the sport ends.
That's exactly.
They hated it unconsciously because it was forced on them, and they don't exercise at all. They don't know how to exercise for fitness, so they're not out there gently jogging or on a Stairmaster or doing resistance training in a way that's actually sustainable without injury, that keeps the weight off and improves insulin resistance, creates muscle mass that is more parking lots for that glucose, better insulin resistance, etc. Is that what you're seeing too?
Yeah. I mean, again, coming back to a lot of my entrepreneurs, many of them were burned out athletes that played soccer like crazy. They did crew, whatever they did. And now they really don't exercise for pleasure. And it's the same with music too. Some of them actually have, I didn't even realize this when my kids started playing piano, that there's a specific track that you can go on where you can put it on your college credentials. Like literally you take a certification test. We had no idea. And their first piano teacher told us about that. And we're like, this is weird. Yeah. And then they were not enjoying the music at all. It was just like another school subject. So we scrapped the teacher and we got another teacher that plays movie theme music, and they were already obsessed with Star Wars. I mean, you know that. Where can you go wrong with that? They love that. And then their latest teacher, we just shifted for a different reason, is introducing anime and music that they love. And now literally we can't pull them away from the keyboard sometimes. And to me, that's a blessing to me, because you're developing interests and hobbies that they can use later in their life when life is chaotic, right? Absolutely. I want them to turn to the keyboard and not resent that. So,
absolutely. So they can be like, somebody once told me the world is sure to roll me. I ain't the sharpest tool in the shed. It's funny because my daughter, my 8-year-old, they both play violin. They're really good at it, and they enjoy it. I think because we've asked them to quit several times. We've asked them to quit because it's hard on us.
Sure.
And I'm like, this is about us, okay? And they're like, no, we like this. We enjoy this. It gives us joy. I'm like, okay, cool. Well, she picked up my guitar, which is way too big for her. And I showed her to play how to play Jesse's Girl,
Oh, how fun.
Ding, 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 ding. I wish that I had Jesse's pen.
I've never seen you in any of your videos. Do you play guitar at all?
Occasionally. Yeah,
okay.
Occasionally,
I'll have to look for those. Okay.
Yeah, it's fun. But I'm not that good at it.
Okay.
So because I suck. But I only played it for fun. I never played it, and so that was great. So it's still part of joy in my life, like you said. Yeah. To this day, if I'm like feeling stressed, I can pick up a guitar and just play stuff. And it's now helped inform what I do in my life with the show and everything else.
Sure.
But so she picked up the guitar and she's like, this is so much fun. I want a guitar that's my size. Cool. And I was like, yeah, sure, you're going to play it. No, she's like, really, please, Daddy, when will you take me to go buy a guitar that's this size?
Awesome.
And I was like, are you kidding me? She's like, no, I'll play it every single day. This is so much fun. I'm like, I'm going to go this weekend and get her a little guitar. And then she's going to stop playing it, or she's going to smash it over her sister's head. But either way, this idea that joy, that, this is really what life should be about.
You're right. It's present day joy, because, it's interesting. So I gave a talk at a particular venue where they had some college counselors there. And this is a type A college academy. And literally what his talk was is, you work your butt off right now and do all these things, and you're going to defer joy because you're going to make it to this school. You're going to get here. You're going to have unlimited money. So it's always that deferred gratification. And we heard this from parents too. Work hard right now, and you can become this, and you'll have millions of dollars, whatever.
It's a medical saga.
Exactly. It is a medical saga. But it's like, if you don't create opportunities for joy now for your kids and yourself, you're going to, like you said, the hedonic treadmill is going to keep spinning, and you're going to miss all these opportunities. They're going to blow right by you.
Life is gone.
It's gone.
You're on your deathbed, full of regret.
Yeah.
And that's, I'm not going to allow it to happen. I'm not going to let this place destroy me, Ronesh Sinha.
Right, exactly.
This place is the dark
We're in it
side.
together. Let's do it.
It's one of the most beautiful places on earth.
It is.
The food is amazing.
It's a mirage sometimes.
It is. It's a mirage.
Yeah.
And then you realize that the people are stressed, man. And they stress you out.
They do.
You got to transcend it, and there's ways to do it. Now, I would be remiss if we didn't end the podcast if I asked two other questions. One is, what's the deal with vitamin D and sun? Because that's something that seems like people's vitamin D levels are low, particularly in South Asians.
Yeah.
How are you thinking about that? Are you repleting vitamin D by supplement, or what are you telling people?
So there's a lot of murky science behind this. So what I would say is I think there is a camp out there that thinks with vitamin D levels that the higher you go, the better it is. So they're going 60, 80 plus nanograms per milliliter. And I think there's risks to that.
Yeah.
But on the other hand, if you're someone that's in the teens and really low, I don't think we're doing your body any benefits by having you that low. The first step would be, if possible, can we get more sunlight exposure? Now, if you've got dark skin and you're in a day job where you have to wear clothes, you're not a lifeguard, it may not be adequate to get enough sun to get your vitamin D levels up to normal. But my first message is let's try to get more sun exposure. This is a sign, a metabolic sign that your body's calling out for more connection to nature. Now, on top of that, we probably, vitamin D rich foods can help a little bit, but we probably do have to supplement you up to a specific level. Because if you look at vitamin D studies out there that show there's no benefit, the vast majority of them did not even measure levels of vitamin D before and after. They're just looking at outcomes. They'll put you on 400 units of vitamin D, which is hardly anything, and then let's see what happens to fracture risk or outcomes on various chronic health conditions. But if you did a well-designed study, and the few that are out there, you often do see improvements in things like blood pressure and glucose metabolism. So I'd say it does have a role in moderation. Lifestyle first.
Get out in the sun a little bit.
Definitely. That's
within
not going to
tolerance.
hurt you.
If you're, Caucasian redhead, probably less good
Right,
to do
exactly.
that.
Yeah.
Higher cancer risk.
Yeah.
And then intermittent fasting, because this is a path that after going through low carb, ketosis, that kind of thing, I've kind of settled on as a sustainable path for me.
Yeah.
I'm just a 1 meal a day type of, restricted feeding window.
Yeah.
What's your thought on intermittent fasting benefits or lack thereof in your population that you treat?
So you have to customize it, just like anything else. So I know it sounds like a cure-all for everyone. For some individuals, it works phenomenally on every front. Typically, those tend to be males. Works very well. For others, because we see so many individuals, particularly females, that are coming into my clinic already nutrient deficient, they already have a lot of inflammation. If you tell them to eat 1 meal or 2 meals a day within a tight window, you're missing out on opportunities to provide adequate nutrients that their body needs. So I tell people intermittent fasting is it might be a goal we work towards, but first we just have to nourish your body before we start starving your body, right? So I literally just saw a patient early this morning, and she has not responded well to fasting at all. She's felt terrible, terrible. Her hair is coming out. She's gaining more weight. And she was someone, originally I told her, if we don't get your nutrient imbalances corrected first and work on stress and sleep, this is going to be a stressor to you. And that's exactly what it was. Now, over time, when we build that system back in, then intermittent fasting might be a powerful tool. And when we say fasting, again, people get competitive around fasting.
Oh, heck yeah.
Fasting in Hinduism was a very selfless act. It was a renunciation. It's something you offer selflessly to some God figure. But here, I go to Silicon Valley parties. Hey, how many hours did you do? Oh, I did 3 days. Or what about 5 days? What about 7 days, right? It's like everything is so crazy here. But for some people, guess what? Just having 12 hours or 13 hours, that might be good to do. Or use intermittent fasting, PRN. If you went crazy on the weekend, you flooded your system with glucose and muscles, Monday, Tuesday, Wednesday. Now we're going to be hitting holiday season. That might be a good time to do some corrective intermittent fasting to empty out some of the nutrients. So that's the way I think about it.
I think that's a very rational way to think about it. Yeah, and it's different for every single person.
Right.
So, Ron, man, we've done a tour de force here.
We sure have.
I don't know how long have we been going. How long have we gone? Hour
What? Get out of
30?
here! Seriously?
What the heck?
Oh my god,
dude! I was in like a
even
time
I'm
warp.
shocked,
I
too,
know,
right?
Dude. These guys are like back here. They're like,
yeah, there we go. They're like meditating back
that's
there.
right.
And
Except for
doing
Tom,
their nasal breathing.
Because in Tom's mind, he's nasal breathing. Somebody wants to.
God, there we go.
So
I'm not going to get that song out of my head. Thank you.
You're welcome. So listen, the thing about Ron is he's got this book, South Asian Diet Solution. Is that what it's called?
It's Health Solution.
Health
Close
Solution.
enough. That's
Health
okay.
Solution.
Yeah.
Great book. I read it.
Thank
Wonderful. You. We'll put in links. He's also does seminars. You have a website, yeah?
I do.
Yeah.
So it can be my name, roneshsinha.com is the easiest way to get there.
Awesome.
Yeah.
RONESH.
Yep. And SINHA.
SINHA.com. And we'll put it in the links. This was great. I'm hoping that for supporters who support the show and subscribe, they can get CE, CME, CEU credits, ANCC and AMA accredited credits, and you'll take a post text. The instructions will be in the web post because we want to educate and entertain. like Smash Mouth. I figure they're both educational and entertaining. Ron, you've taught me a lot. You're a colleague. You're awesome. You're a fellow
Appreciate it.
brother.
I feel the same way about you. Yeah.
And it's been a joy to have you on the show. I hope people take away a lot from this
Thank
as
you.
much as I took away from it.
Thanks.
Come back, will you?
Oh, absolutely.
Because we're going to outgun each other because we're here in the
right,
Silicon
exactly.
Valley.
You
I'm
got
like,
it.
well,
Yep.
Ron, how many views did you get on that show?
Oh,
I
no.
bet we could beat it. And ZPAC, we love you. Do me a favor, subscribe on YouTube. Click the little bell icon to turn notifications on so you always get a little dingleberry notification. Is that the technical term? And become a supporter if you aren't one already, because we have the deep dive discussions. I got a lot of the questions that I'm asking Ron here from our supporter tribe. You can have a voice and we can change healthcare together. What do you think, Ron? Are we out?
We out.
My brother.
All right. Thank you, my friend.
What a
All right.
pleasure. God Almighty. Lovely. Lovely.